Welcome back to Global Health, and this is Unit 4. We're going to be talking about global viral threats, and so I'll be focusing on the Ebola viral disease outbreak, as well as mentioning some of the other global pandemic risks that we have had in the past. But I am actually an infectious disease freak. I think that I'm more interested in viruses and different types of infections like malaria than probably anything else. So I will try to do this in 2 or 3 subparts so that it will be easy for you to follow and get excited as well about the possibility of being we've got a germ freak who are outwitting the viruses. This is a picture actually of the coronavirus, the MERS virus. And as we know, global health has to do with not only infections or different types of health hazards that are in all over the world, but how that spread. So it's actually focuses sometimes on epidemiology, where we're looking at the reason why diseases spread. We're looking at close contact. So you can see we have travelers as well. We have an area here. This particular map has to do with Ebola virus disease. But again, we had travelers that went from Sierra Leone right down to Nigeria and different places around the world, including someone, Eric Duncan, who flew from Liberia into Dallas-Fort Worth Airport. And he was visiting a family member there, and he actually got very sick, and he actually died in the United States. Welcome back to Global Health. This is Unit 4, and we're going to be talking about infectious disease prevention. And I guess this last year, with the Ebola outbreak in West Africa, has been a great opportunity to talk about global health and prevention of infectious disease. So if we look at global viral threats, here's a picture of the coronavirus that is actually a brand new virus that no one has ever been exposed to before. It's in the Middle East right now, and this is of concern to me because it's near where I live in Saudi Arabia. This book is kind of a silly way of looking at it. You can be a germ freak, and I know that as a microbiologist, I had to do a lot of different tests and evaluations to look at the actual epidemiology of viral infections. One of the things about having a global viral threat is that we have international travelers. So here I am flying from Abu Dhabi back and forth to Texas because I teach with Texas A&M University in Texas, as well as flying from US or Abu Dhabi down to Colombia. So even I could be a global viral threat carrying different types of infections. I'm not, but I'm just saying that people travel all the time. Business people travel. International travel is very common now. And so we have to consider people traveling from West Africa, say Liberia, to the United States, or even to Nigeria, closer to other countries nearby. As an example, one of the things that we hear a lot about in the news at certain times of the year is the influenza. So the global viral threat of pandemic influenza is actually very real, and the World Health Organization does a lot to prepare for it every year. One of the things that happens in the Middle East, where I'm currently living, is that we have Mecca. Saudi Arabia is the host country for Mecca, and every Muslim in the world is supposed to make one pilgrimage to Mecca. And so every year they have these tremendous crowds of people that come at certain times of the year, either during the different Ramadan, for the Hajj, which is going to be coming up in October this year. It shifts just like Easter through the year. So Eid al-Fitr was in July this year, and then the Hajj is after. So we have Eid al-Adha, and it's going to be in October. So the weather will actually be a lot cooler by then in Saudi Arabia. You can see the massive crowds, and if someone was ill with either influenza or with the Middle East respiratory syndrome, it could be easily spread, especially a viral illness. So we can make jokes and say mad cow disease, we could say swine flu. We had concern about pandemic readiness for a swine flu, even though it started in Mexico and started to spread around the world. It didn't turn out to be a pandemic, so we could calm down, but it was frightening for a moment. We had to consider whether it might be. I know I was working with the American Red Cross in Thailand when swine flu became an international health issue, global health problem. And we were issued the N95 masks, and we were given the antibiotics and so on for our families because we might be going to the front line related to swine flu. We were glad that it didn't turn into a pandemic. Other viral threats, I mentioned MERS. It's a Middle East respiratory syndrome. It's a type of coronavirus. The outbreak was first identified, and the virus was identified as a brand new virus that no one has ever seen before in April 2010 and 2012. The coronavirus is very similar to the severe acute respiratory syndrome SARS, and I'm familiar with that in that it was a long time ago in 2003, but we actually lived in Indonesia at that time, and it was a big concern because Indonesia really doesn't have very adequate public health surveillance. So it was a real concern that SARS would be a problem there. And in May 2014, we still have confirmed cases for the MERS, and it was a traveler to the United States. So again, we're worried about global viral threats, and it's very often related to international travelers. The viral threat, as I said, I was issued an N95 mask because those are very commonly used as a respirator to protect healthcare workers, and you have to be sure to fit them on properly. So again, this is a type of protection that you're likely to have in working with hospital settings or in clinics. The working with people that have respiratory disease to protect you. The global health threat for MERS is now, they have a total of, it says 1382. I got this off the WHO site today. So this is as of August 8th. And there have been almost 500 deaths. So it's about a 36 to 40% death rate. So it's actually been fairly severe, comparable to the death rate for Ebola. So again, it hasn't had as many cases, and it's been restricted fairly well to the Middle East with a few travelers internationally. I think there was a confirmed case in Germany. Again, the main issue here that we want to focus on is the Ebola outbreak, and this highlights the need for global health surveillance, the different types of controls, the World Health Organization, and in the U.S. we have the Centers for Disease Control. I think you have a very excellent surveillance system in Colombia as well, and a lot of national organizations that are responsible for surveillance for epidemiology. Ebola virus disease, formerly known as the Ebola hemorrhagic fever. That's what I learned it as in school, because of course it's been identified since the 70s. That virus has been around. We've known about it for 45, 50 years. And it's transmitted to people by wild animals. So it could be bats, it could be monkeys, other primates. It can spread human to human once an individual is infected. They very often will take it home to their families. Recent update, just from last month in July, the World Health Organization says that in West Africa, the Ebola outbreak that started last year has stabilized. They're monitoring a few cases that are coming up right now, but it says that it might persist for a considerable length of time. So they've done some really dramatic curfews and having everybody stay home for a week at a time. It's been remarkable to see the types of things that they have attempted to do to control the Ebola virus. In 2004, we have an outbreak primarily in Sierra Leone, Guinea, Senegal, and Liberia. And of course, there were cases that people traveled to Nigeria seeking care. They traveled other places in the world, United States as an example. We had Thomas Eric Duncan, who flew from Liberia to Dallas-Fort Worth in Texas. And unfortunately, he was visiting his family there when he fell ill, and he actually succumbed. They didn't identify the virus early enough to give him the type of care that he needed. That really woke everybody up, that something like that could happen. There have been a total of almost 28,000 confirmed cases, and about half of those have died. But if we look at historically, in 1976, so this is what I was talking about, when I lived in West Africa, in Gabon, we actually heard about cases of Ebola. They considered it to be endemic. Hunters would go out to catch monkeys, and they would shoot them to use them for food, and they would become infected with Ebola. In 1976, Ebola outbreak, it was in Zaire, but that is now called the Democratic Republic of Congo. There were 318 cases total in that period of time, but you can see the death rate was very high. Very few people survived Ebola in the 1976 outbreak. The United Nations and the World Health Organization considered at that time Ebola virus, as well as other hemorrhagic fevers like Marburg hemorrhagic fever. They've been identified all these years, but they tend to have small little outbreaks, just a few people involved, less than 500, and they said it was self-limiting, and what they mean by that is that actually whole little villages everyone would die, and that's really sad. And they considered it to be of little international importance because it hadn't spread across borders. The 2014 outbreak that started last year was much more severe. It went across borders immediately. We had a grandmother who took her little 2-year-old grandson across borders to get medical care, and that's how it all was spread to so many people, because that sick child who did die exposed so many people during her travel across. Here's a different chronology. It's a timeline looking at Ebola virus disease. So you can see we have our first outbreak in Zaire, although the virus was identified in laboratories earlier than that. So we're looking at 1970, so that's 45 years ago. And then we have different incidents here. I've mentioned here is in Gabon. This is from the Centers for Disease Control in the United States, this graph. Again, outbreak in Democratic Republic of Congo in 1995. In 2000, again, Uganda also had an outbreak. And then more recently, 2007, there were a total of, this all started more recently. You see, there's a lot of different outbreaks that nothing was done until this occasion. Our response so far, you can see they have lots of representative countries here, but primarily Guinea, Liberia, and Sierra Leone. The World Health Organization was working directly with those national organizations to accomplish all the remarkable work that had been done to stop this epidemic. The confirmed deaths, and this is updated as of the 5th of August from the World Health Organization. You have to download their actual spreadsheet to see the different counts now. And it, as mentioned, it's almost 28,000 people with confirmed cases, and of those, 11,000 have died. So you can see it's a very high death rate. We're going to wrap up by mentioning that Ebola patients arrived in August last year in 2014 at Welcome back, Global Health, Infectious Disease Prevention. This is Unit 4, Part 2, and we're continuing our discussion of global health and Ebola viral disease. I had mentioned that in August, so 1 year ago in 2014, our first missionaries started coming back from West Africa to the Centers for Disease Control, is all integrated with Emory University Hospital in Atlanta. And so this were the first patients that were treated with an experimental type of supportive care that seemed to have been successful because the patients survived Ebola. And so we had Ebola viral disease in the United States. And so here's a World Health Organization report, and it indicates that this was in September 2014. Here we have a report from World Health Organization for the Ebola case in Spain. So again, these were international travelers who came from West Africa. So the Ebola and Marburg viruses are well known. They've been studied for decades, and the most innovative research was done by the London School of Tropical Medicine and Hygiene, and that's one of the premier universities in the world that teaches epidemiology. They do courses all over the world, and it's where Peter Pinot, who is the executive director for United Nations HIV/AIDS organization, so UNAIDS, identified Ebola virus in the 1970s. It has a natural history with known reservoirs, again, wild animals. The bats is a common one, different types of primates. It's endemic to Africa, and it's a filamentous RNA virus, so they actually know quite a bit about it. The current outbreak that we're looking at, that's still going on, started last year in Liberia. It's also affected Guinea, Sierra Leone, Senegal, Democratic Republic of Congo, of course, United States and Spain that we just mentioned. And there were some cases of patients trying to go to Lagos, Nigeria, because they had hospitals there to seek care. The reservoirs are infected animals, so bats and primates, direct contact with their blood. So we're talking about hunters and eating meat that is not properly cooked. So these secretions in the blood from the animals that they're hunting with, they get on the people and they get infections. Incubation period is up to 3 weeks, so that's why when they quarantine people, they make sure that they are isolated from others for 21 days, and it's very deadly. So we're looking at about 50% of the people succumbed to this infection. So if you want to read more about it and the epidemiology, the World Health Organization and Centers for Disease Control have some excellent pages. So here's some pictures just as a reminder of the different animals. Bats has been incriminated in the Philippines, say, but in Africa we have antelope, porcupines, different types of chimpanzees, gorillas. So anything that has a warm body, any mammal could transmit the disease. And so Ebola is not airborne, so it's actually, it can be aerosolized. When someone is so acutely ill, you can imagine that they're sneezing, they're coughing, they're bleeding, they're very ill. So there's a lot of secretions that could be sprayed, potentially aerosolized. So it's not airborne, but it can be transmitted from person to person. So again, it enters the blood through the skin, primarily the mucous membrane, so the sensitive membranes around your eyes, your mouth, your nose. So this is where it it's less likely to go directly into your skin. So some of the people, the nurses that were caring for the Ebola patient in Dallas, Texas, actually were exposed to Ebola from the patient, and that is why they went to a lot of very quick revision of the type of protective equipment, the respirators, the types of gloves, how to don and doff, put on and take off the protective equipment that they need to wear around someone that has this very easily transmitted fatal illness. Again, the response, you could see the amount of money that was spent. Here's the World Health Organization, the budget for plannings to also strengthen the national public health systems in Guinea, in Liberia, Sierra Leone. So the government plans, they're in the $21 million range for the sequential years, each country. And the total financial gap that they need, another $71 million. So even with all the contributions for the countries that are there, supporting organizations, United Nations, again, money's come in from all over the world, from Spain, from United States, from Canada, to support the different types of infrastructure that are needed to improve, and yet they only raised about 10% of what they felt that they'd need to adequately protect and rebuild these weak healthcare systems. So that's to keep in mind that it is, bottom line, it costs a lot of money to do all these things. Prevention, of course, Centers for Disease Control, and an organization that I haven't mentioned before, it's the Occupational Safety and Health Administration. It's called OSHA in the United States. And they have fact sheets protecting against any kind of pandemic. So infectious disease that can spread from person to person. Mainly it's just hand washing, and that is amazing to think that even if you were worried about being exposed to Ebola in, say, traveling together in an aircraft, if you wash your hands, it would be the number one thing that will protect you. So it just seems like that it's essential during any kind of worldwide outbreak. I know during the SARS outbreak, I'm not close enough to the computer. During the SARS outbreak, I know I just gave my family these little alcohol wipes and different things to use while they're traveling, because it was hand hygiene they were emphasizing. So consistent hand hygiene, using soap and water is much better than using any of these gel products or just plain old soap and water. Potentially effective vaccine now is being tried. This is remarkable because we're talking about less than a 12-month timeline that this has been developed. So this is very good news. Just earlier this month, they were announcing that it's an extremely promising vaccine has been tried, and they're using it for healthcare providers right now. And they did quite a big study. I think it was several thousand people that if they were exposed to Ebola virus. So it's very ethical trial. All of these people were exposed to Ebola virus. Half of them were given the vaccine, half of them were not. And I think that the people that had standard treatment, they were given supportive care, and many of them recovered. A few people did come down with the Ebola virus, whereas the people that got the vaccine, because again, they have to make sure that it's safe to use, none of them did. So this is it's a phase 3 efficacy vaccine trial, and it was developed by Merck, and it was originally identified, this particular vaccine was developed in Canada. So with all the people working together is what they're emphasizing in such a short timeline. It's been remarkable that they have a very promising vaccine that may be used widely. So again, they're saying wash your hands often and carry on. you can't just be frozen in space when you have a global epidemic. I think that when we're talking about a pandemic for influenza, you say, well, flu, yeah. I mean, they have flu shots. Most people, if you're not very young or very old, can survive having influenza. You're really sick, but Ebola, you had a much greater chance to succumb. It's very often fatal. So I think that people were more frightened by it, and they had to develop more different types of protective equipment and protective devices. Look, they're spraying down this person who works in the clinic with, or actually they might be helping with the funeral services for people that have died. So you can see the heavy gloves, and they're spraying them down with chlorine solutions. And this is almost like what you would see when you have radioactive material. These types of decontamination procedures were very elaborate. And so they had to experiment to see what worked best. Again, avoid getting sick by, when you're traveling, just try to be sure to wash your hands. Or if you're using the gel, make sure it has 60% alcohol. Be considerate, just like they have recommendations for cold season influenza. Don't touch your eyes and nose, all those types of things. Sneeze into your sleeve so you won't be spreading viruses that you have to others with your hands. So again, these are, I like to think about the hand hygiene. They have excellent materials, songs and everything online. I know my grandchildren, they like this, they wash and they're humming Happy Birthday. And I must admit, my grandson, he's a bit of a speed washer. And so that's not going to help him be protected against infectious disease if he doesn't wash his hands for long enough. So the World Health Organization has the procedures for hand washing and hand rub. I know one of the things I do in some of my classes, if we were in class together, a traditional classroom, we have a demonstration. Maybe I'll film them next time. That would be fun. Where people put on the nitrile gloves, and I have two people, and they put the blindfold on, and they give them red paint. And they're trying to spread it to see how well they actually cover their fingers. So I think that it's good to demonstrate the proper hand washing procedures using these different techniques, the water-based paint. Because if you aren't washing your hands, it's just like eating with your shoe. I think that most of this picture kind of grosses people out, but it is very effective in giving you the idea of where your hand has been. And so this young man is wolfing down something to eat with his dirty hand, which is like eating with your shoe. Again, universal precautions for healthcare providers. They had special procedures for putting on and taking off your protective gear. So it's important that they put on the gown, the mask, the face shield, the goggles, and the gloves in that order. And then reversing that is actually quite hard. And that's another thing that I do with my classes, is that I give everybody, and I make it easy. I tell them that they just have to have one glove. Okay, so I tell them to put on this glove. So these men and women are shoving on this tight-fitting glove, and I say, okay, now we're ready to take it off. You've taken off one glove. You're taking off another, the second glove, and it's contaminated. How can you do it? You slide your finger under and roll it. But they find it's actually quite difficult to do that. So it's not surprising that the safe handling of your gloves and your mask and so on, when you are exposed to patients that are very sick, is tricky, and it needs practice. So we're going to be starting to talk a little bit more about the universal precautions when we start back with part 3. Right, we're back. Global Health, Infectious Disease Prevention. This is Unit 4, Part 3. And we're going to continue to discuss Ebola outbreak, but we want to wrap up with some conclusions and give you an assignment. I really want you to look at the PBS film that is about one family and their struggle in Liberia when they were surrounded by other families with Ebola viral disease. And one of the things you'll be doing is summarizing different types of solutions that you might be thinking about and how this might have been prevented. So we're talking about the Ebola outbreak, and we were talking about universal precautions and the fact that the September Liberian patient who came to Texas and was treated, this is a picture from the hospital room where Mr. Duncan actually died, and this physician was fine, but the two young nurses that took care of him were exposed, and they were treated for Ebola disease, and they both survived. So again, it's very important to emphasize universal precautions. The gloves, of course, are particularly difficult because, of course, they're tight and they're difficult to get off when you are trying to peel them off inside out to prevent you from touching the contaminated surface on the outside. There are lots of different excellent teaching guides that talk about universal precautions. I particularly like this one. Again, it is from Canada, and it's Protect Patty, and she's a nurse, and she is putting on her what they call personal protective equipment, or PPE. And this was a whole slide series that was originally developed by the Pan American Health Organization, or PAHO. And here's one of the screens where they're showing her with her different gloves and goggles and the respirator and her gown and the different steps that she will take to make sure that she is putting on, which is donning, and taking off, which is doffing, her protective equipment correctly. So it's an online tutorial and reminder. I think that most of the places that have these types of high security rooms for infectious patients also actually practice. You know, they time them, they practice. It takes lots of practice to be able to do things well. So the best thing that they recommend for prevention of infectious disease is get your annual flu shot, have your tetanus and your diphtheria, pertussis, tetanus, or what they in the U.S. they call the DPT, the measles, mumps, rubella, your varicella. I know that they very often will give that, or the herpes zoster virus that prevents shingles. Different types of viral infections you can get immunizations against. So routine immunizations just for general health, and for situations where you're actually working in an expatriate location, you're maybe a healthcare provider or supporting clinics in West Africa, you want to go ahead and have typhoid and hepatitis A and B vaccine. So again, these are all things that keep you protected so that you can work more effectively. The diagnostic tests for Ebola virus infection, again, you're looking for symptoms. They have acute bleeding and hemorrhaging in the skin and internal organs. So it's quite a rapid progression. They can die within days. It's really sad. The laboratory tests, of course, they have an enzyme-linked immunoabsorbent assay. So these will all be tested in reference laboratories. So there are such a variety of clinical presentations of people with Ebola. That was one of the things they had to really keep refining and defining for people to better identify cases so they can get treatment. And now they're going to be continuing to use the vaccine that has been proven to be very successful. The International Federation of Red Cross, Red Crescent, is very active in all over the world, and it's one of the ways that you could contribute in the future. I work with the International Federation Red Cross, Red Crescent. They actually had offices in Bangkok, Thailand, where I was. So in Southeast Asia, we were deployed to lots of different countries. I was routinely sent to Sri Lanka, India, Maldives, and then Sumatra, northern part of Aceh in Indonesia. So these were all my assignments. But basically, if you work for the IFRC, which is the International Federation of Red Cross, you could be working anywhere. You could work in Haiti, you can work in lots of different countries. You work alongside even the Colombian Red Cross, so that you gain a lot of skills and understanding and share your expertise. So I think that for the students here that are nurses, there's a natural extension of your abilities in getting practical skills working with the Red Cross, but also for the physiotherapists, the students that are going to be doing rehabilitation and practitioners. I think that we are really looking at the need for a lot more treatment of patients, rehabilitation, following different types of injuries and during natural disasters, or even through guerrilla warfare or civil strife. In Sudan, people are injured and they are taking a long time to recuperate. So there's a lot of opportunities for you in global health. Again, regional virus threats or global viral threats. 1 year later, who could spread it faster? Infectious disease prevention, when we're talking about Sierra Leone, Guinea, and Liberia, they have now learned so much by the different methods they used. They had basic lockdowns in whole communities, so no one even went out to buy food. They warned people they're going to have a lockdown at a certain time. Incredible effort to try to control this Ebola virus. And the main thing is that we have to communicate this information and make sure people are listening. I know that the PBS had done an excellent series. We also, World Health Organization didn't recommend screening at airports. That's with the SARS outbreak, they did do screening. So, for example, I'm going to be flying through Dubai in the United Arab Emirates. It's one of the world's busiest airports, and we get people from all over the world. So you'll have Africans coming north through Dubai. You've got the people from South Asia or Southeast Asia, China, coming through Dubai. They have been a product of their over success. They say that they have 140 airlines flying to more than 260 destinations. So you can see if something like MERS, which is the Middle Eastern Respiratory Syndrome, someone from Dubai got on one of those aircraft, there are over 6 million, almost 6.5 million passengers going through that airport. It's always very crowded. There's rarely even a place to sit down. That's how busy Dubai Airport is. So you can see a hub like this could be a great source of infectious disease spread. A commitment of resources. We talked about the money that the national organizations and the UN provided $7 million, but they actually there was a shortfall of $72 million to actually restore and build a better infrastructure so that this type of massive outbreak would be unlikely to happen again. I know that the U.S., along with a lot of other foreign nations, committed a lot of manpower, so that's resources and that's expensive. They have the different troops that went. I sometimes will show this video. I think I'll skip it this time. You'll have it as an optional video for you. It actually shows the U.S. Military Army coming in, setting up an emergency camp, and this was outside of Monrovia, Liberia, and they had a mission that they were trying to support and try to evacuate people that were ill and develop protocols for safety. Here we have an example of the community effort, because again, these people were frightened. They were trying to get the care they needed. They didn't want to get exposed to Ebola. So you can see these basic information about what they should do and what they should not do. And one of the places that they discovered was the greatest source for the potential spread of Ebola was that culturally, they normally, if you have a family member who dies, they have ways that they prepare the body for funeral, which involves washing the body, wrapping them. And so that was where a lot of people became ill from the dead family member. And so they tried to revise and give advice about safe handling, have the proper types of funerals, because that would be appropriate, but also protect the family's members from getting ill also. There are lots of resources that are available now. Again, we look at the European Centers for Disease Prevention. Of course, the Spanish public health organizations have excellent materials that would be in Spanish. I tend to go to Mayo Clinic, which is nestled in the University of Minnesota, Centers for Disease Control, World Health Organization, and there's another institutes, the National Institutes of Health, NIH, which has Medline. These are all excellent sources of information and accurate, correct information. There, of course, the Centers for Disease Control has an Ebola site with updates that you can log into and get the recent numbers. World Health Organization is the premier organization that publishes all the numbers, and they work through nations because World Health Organization is part of United Nations organization. European Commission, they have an interactive guide. It's really kind of cool. When you get online to this particular site, you touch on the country you're interested in, say France or Spain, and then it gives you the latest developments. And so it has to do with all kinds of infectious disease as well as Ebola. Because you have to keep in mind when you're looking for long-term solutions, because that's one of the challenges I've given you with this particular module for your assignment. You'll be submitting your ideas for long-term solutions. And look at the diversity and how huge Africa is. Here's China, here's the United States, France, Spain, India. You can see that the diversity of all these different nationalities and cultures, it's enormous. And having worked in different parts of Africa for 6 years, I just felt like I barely got my feet under me. There's so much more that I had to learn. So In the Shadow of Ebola, it's a PBS video. I have the link here. I'll be putting the video online for you to see. And again, we want to look at infectious disease prevention and how you feel about what's happened to Emmanuel's family a year later. So we're looking back now, they say, about the crisis as well as a year later. So it's very interesting. I have the web link here for you to look at as well. Then we look at the armor, defense, safeguarding, carefulness, caution, all the different words that you think of when you're looking at protection for infectious disease. So your discussion forum, I'm hoping that you will do these 3 activities. Recommend long-term solutions is one of the things if we want to make a stronger public health system there. Compare World Health Organization's response in 2014, where all in, they spent close to $8 million and still needing a lot more, millions and millions of dollars to improve the public health systems in West Africa. In contrast to the 1976 outbreak in Zaire, which is now called the Democratic Republic of Congo, and how they had small numbers, but over many, many years really did nothing. And that's what is so sad. Even though they knew this was a very, very virulent disease that killed people quickly, they did nothing to create a vaccine until we had this enormous number of deaths. 28,000 people with cases, almost 12,000